You will leave here today excited, ready to be part of this program and to bring it to your department. We will cover some of these topics today, and if we didn't get to your question, we will do a follow-up afterwards, and we'll send out an FAQ and a recording of this as well. We'll go into an overview of the program, how you get to verification card, and then we'll welcome in our panel discussion. So this is the first and the only verification for triage. We have created the standard education out there for triage, and this program is a day and a half. It includes pre-coursework, and there are skills and written exams following. Upon completing all components of this, you will receive 22 contact hours. So this is an ANCC accredited program. We were very mindful in putting together the agenda for this program and the topics we were going to cover. Our special populations and considerations dive into pediatric, older adult, the OB, and the postpartum patient. We focused on the common ED presentations for our assessment and questioning. We have great engaging conversations around supporting our acuity decision, what documentation is important at triage, and how we're getting to our acuity level and what that means for the patient's trajectory of care. We go into communication throughout the department, why it's important, strategies around the challenges, and ways to come out of barriers. We have multiple triage scenarios throughout the program, and we spend a little time at the end of day 2 focusing on our own self-care and as a triage nurse. Of course, ESI is covered throughout the pre-course work and in the day and a half, and we talk about nuances to approaching the algorithm, applying challenges, having in the department, the utilization of it, and again, very mindful in all these topics that were covered in the depth of them. The topics chosen are also supported by research. We did do a survey study here at ENA. We had many respondents, over 1,100, that included managers, ED educators, and staff nurses, answering certain questions about the topics, about the importance of the topics, and different competencies for a triage nurse. The 5 domains covered: clinical judgment, communication, expert assessment, timely decisions, and management of medical resources. So again, these topics are supported by evidence based on their importance and what does it mean to be competent out at triage, and how can we verify through this program that that knowledge is present of those competencies. So how do we get to that verification card? Be handed the pre-course work 30 days prior to the live course and must be completed to be allowed into the live day course. We were mindful in mirroring some of our other verifications so that most are aware of how we get to the verification. So that's that 30-day completion of the pre-course work that's assigned. Attending the day and a half live course. This program is offered virtual and in person. So it's either attending live or virtual, depending on what is chosen to attend, and then passing those exams. The written exam is set up like our other verifications, where you have 7 days to complete at the close of day 2. There is needing to be successful completion of the skills on day 2 to get access to that written exam. It is a 50-question written exam. There is, again, that 7 days to complete it. And upon successful completion of both, attending the live course and having your pre-course done, you will receive a verification card that is good for 4 years. I will have more exciting things to share later, but at this time, I do want to welcome our panelists. We have a few of them on. They are pilot participants. I first want to welcome Martha Boone. I will let her give her a little introduction about herself.
Hello, my name is Martha Boone. I'm fortunate enough to be one of the ENTEP instructors. I really enjoy going around and meeting hospitals and nurses and realizing that we all have the same challenges when it comes to ESI and triage. And so if you do feel like your facility has challenges with that and needs some help with that, you're not alone. It happens with all EDs. I am a clinical nurse specialist in an ED at the Atrium Health Wake Forest Baptist Medical Center in North Carolina. And I have been an ED nurse for a very long time and have been a clinical nurse specialist for several years. I work a lot on education and best practice and quality measures, and I'm very happy to be here.
Nick Sprinkle. I am a new nurse. I am a new grad in the New Grad Academy here at Wake Forest Baptist Atrium Health's main campus ED. Um, I have switched to nursing after a 10-year career in teaching, and I was given the opportunity to take part in this program that traditionally I think has been oriented towards more experienced nurses, and I got to learn alongside them. And I had a really great experience with that, and I'm happy to share my experiences with you today.
Hi, my name is Kara McKinney. I am a nurse professional development specialist. I also work at Atrium Health Wake Forest Baptist. I've been an emergency room nurse for about 12 years now, I think. I started as a new grad in the ED, and I've been there ever since. And now I work in clinical education. I did participate in the pilot of this course, and I'm excited to talk to you a little bit about it today.
I'm curious from Martha and Kara why you chose to participate in this program and have your department be part of it.
Was a great opportunity for us, being part of the teaching the program, and also we work very close with new grads. Nick was part of one of our new grad academies. I thought it was a great opportunity for us as a department to get some really in-depth education about triage. And so when we were offered the opportunity to be one of the pilot sites, I thought it was great. I was very excited about it. I actually pulled in some of my educators like Kara, MPDS, and a couple of the educators from the ED to come in because I thought it was an opportunity not only for our new grads and our new nurses to learn, but also for our educators and MPDS to have the opportunity to see what kind of program this is, and maybe we can bring it back for our new grads when it goes live.
So Martha told me about the pilot that was being offered, and I was really excited to hear about it. Like I said, I've been in ED nursing for about 12 years, and I've always really enjoyed working in triage. And, I think that it's one of those areas where you really, really thrive in it and you really love it and you love the challenges of it, or you'd rather just, stick with your patient load and keep to that. But the reality is all nurses do have to know how to triage, and they do have to know how to use ESI and how to prioritize. And that's something that I'm passionate about as an ED educator. And I also cover our ESI and triage content for several of our orientation classes here and our new grads too. So I was excited to see what the ENA had come up with after taking over the ESI algorithm.
Nick, if you wouldn't mind sharing with us what sort of persuaded you to join in too as a learner for the program when you heard about it.
Yeah, I'm happy to. So I think triage, like a lot of things in nursing, is actually a very vast thing in implementation. It sounds simple, but when you get into it, it feels like there's a lot that we need to do. It's almost like whenever I first got introduced to running codes, it's scary, right? There's so much that you have to be able to do, but the way that it's sort of been sold to me and the way that it actually ended up being is that this was an implementation, a deconstruction, and then an opportunity to practice this formulaic way of thinking that gave me the skill set to say, okay, even though I don't know exactly what's going on here or the next step, I have been introduced to the process. So I can always justify my actions and I always know who to ask for help if I do need something. So that's what was promised, that's what was delivered, and it really helped me. So that's why I signed up.
And if any of all of you could share, what have you seen? So a little background, we piloted this through a virtual course in February. And so now we're near the end of May. And I'm curious, what have you seen as the impact, or what have you experienced between the course and now?
Well, unfortunately, we only get to have like 15 people in the class, and I would have liked to have, we have over 100 nurses, and I would have liked to have had every one of them in there, because I think everyone, even no matter how long you've been working in triage, there's something to learn. When I started teaching this program, there was things I could learn, I learned too, and biases that I had that I didn't recognize that I had, until we started really diving into that in the class. And so I think that particularly with our new grads, we had Nick, and we had a few other ones that were pretty inexperienced ER nurses. They came to this class and learned so much, even though they had taken our class. And Nick and Kara does a great job of teaching our class, and it's very has a lot of really good information in it. This is very comprehensive. This is everything you would ever want to know about triage. Where we would maybe cover a topic in about 10 minutes in our class, we spend an hour on it, and we give so many examples in so many different scenarios. And so it really becomes very ingrained in you. You start thinking a completely different way than you do when you first start triaging. So I think that it really has broadened our nurses' ability to be able to see all different kinds of aspects, really look at our special populations and look at them a little differently, look at the biases you may have, and realize that, as someone asked me in class, well, what do you do about your bias? I said, well, you recognize it and you know it and you kind of own it, and then you kind of get past it. But until you recognize and identify it, then you don't know. And so there's so many different types of biases, and we really talk a lot about that. So I think that really has made it a little bit more effortless to triage, because you know what sorts of things you're looking at, and you know what kinds of things you're looking at for each individual patient to be able to go in there and accurately assess their acuity level. Nick, how do you feel? You're the one that's the brand new nurse, and Karen and I have been doing this for just a short period of time. What do you feel like now when you work in triaging a patient? I know you're probably not in triage yet, but when the patient comes in.
I know where to start because we have that flow sheet that you provided. The scariest part, I think, of all of that, and I think that we've actually had conversations about this before, is not whether or not to give someone a 1 or a 2, but feeling confident that I can assign someone a 4, or I can identify a 5. And so the strength, I think, kind of going back to my previous answer, is giving that formula where I can go through and say, do they need something immediately right now to save their life? Just being able to know to ask that question by myself in triage gave me so much confidence if I could say no, and then I have some time to play around and go down that assessment checklist to really talk to them. That has been the greatest strength for me. And of course, I'm still growing, I'm still new, but I can't tell you how good it is to feel to just have a formula in my head.
Thanks, Nick. I appreciate you both sharing your experience so far. And Martha, you mentioned briefly something about special populations, and that requires nuanced approaches, depending, older adult to pediatric. And can you maybe share an example of, since the pilot, how the program's enhanced your ability to triage one of those groups, or a patient from one of those groups?
Sure. I think that if you look at the growing numbers of the older adults, whatever you want to term your older adult as being, in our society, I was doing some reading about this recently and learned that in some other countries, over 50% of their population is turning to be older adults. And so we're seeing more and more of these patients coming into the emergency department, and understanding how they are different and how you have to approach them differently. They may have some cognitive issues. They may have some communication issues. A lot of times they come in and they just say, I don't feel good, or I don't feel like I normally feel. And to be able to get that information out of them and get very specific with what is wrong with them. It's an entire specialty in itself. There's hospitals that have their own older adult area, geriatric area, because they are a special population. You can't look at them the same way as you look at someone who comes in who's about 40, 45, because their nuances with what is going on with their physiology or really impact them and impact how they present, impact them how they feel. They don't feel pain the same way. They don't have cardiac reserves the way that someone younger will. And so you really have to um, look at them differently, and knowing that you have to think about them differently. Same thing with pregnant patients. There's a whole thing that's going on that is normal in a pregnant patient, but is not normal in someone who is not pregnant. And not understanding or knowing those nuances can make you miss things and can make you not look at things quite the same way. We also talk about behavioral health patients, how they present. And of course, pediatric patients, we know that they're not just little people. And they present very differently too. And you really have to think that way before you can accurately assess them in general, and also assess where they need to go. Is this patient going to take my last bed? Is this patient going to need to come back immediately, or can this patient go out into the waiting room? We all have unfortunate circumstances where people don't do well in the waiting room, and they have bad events. But if you learn how to look at each population with how they're presenting and what's going on with them physically, then you can really do a better job of assessing whether or not they should come in the back or they can wait. And I think we cover that. Probably most places who have ESI and triage cover that, but because I know we certainly do, but we don't have the luxury of taking a day and a half to cover all these nuances. And so being able to really spend a lot of time on these special populations and what's different with them and what they can present with and how they're going to look when they present, I think is a real benefit to this class, because it is so in so much details and so many specifics about these certain groups of patients that we see.
Yeah, great. Thanks. Kara, did you want to add anything to that?
I thought the course did a really good job of, again, talking about those finer details of the different populations of people that we see. But one of the examples that I really liked was, the same chief complaint in a pediatric patient is probably going to be a different ESI level in the same chief complaint in an adult patient or a geriatric patient. You can take back pain, abdominal pain, and you can go down the algorithm with any of those age groups, and it's probably going to be a different ESI level. So I thought the course did a really good job of kind of exemplifying that.
Thanks. Part of the curriculum of it is documenting and supporting your acuity decision. And so, Nick, maybe you can address, since the program, what sort of tips you've learned about overcoming challenges with documentation, or things you've been able to apply.
Yeah, so building on what they said, I think about being able to have a little bit more insight about different populations and unique situations. I think the best word that I would use for what I've gained is insight, because there are moments as a new nurse where I still am like, I know something's off, but I can't quite say specifically medically what that is. So in my notations, I will quickly put down maybe a piece of demographic information, maybe just something that was slightly off that I can't say is part of the issue, but I can justify, say, the doctor needs to know this. Just having the confidence to say something's there and I want you to know this has really helped. And also the ability to debrief with people when we're having these discussions in the classroom about those justifications, about those unique situations that we talk about in all of our scenarios has really helped me as well.
I think one of the things that we talk about in some classes that I've taught is about the documentation, because a lot of nurses, particularly newer nurses, are a little bit hesitant to make patients ESI level 2s, ESI level 1s. Everybody kind of gets thrown in the pot of the ESI level 3 because they're nervous about it and they don't want to, I guess, pull the fire alarm when there's no fire. And one of the things that we talk about is you just have to be able to articulate, whether you articulate it in person, whether you articulate with your documentation. Why did I make this patient a level 2? Why did I make this patient a level 1? And if you can articulate it, even if it's to me and I don't think you're right, if you can tell me the reasons why you think it's right, then that's all you have to do. Whether you're right or whether you're wrong, you just have to have the reasoning behind why you did it. And I think this class gives you the tools to be able to say, as you said, Nick, you're more confident. And so that you could go and you could say, well, this is why I did it. Because I remember back in the class, we talked about, life-saving interventions, ACLS meds. What do I need to do in this moment or this patient's going to die? And that's why I made them a 1. And if you can articulate that and document that, then that's all you should have to do. And if you're wrong, you're wrong. And that's okay. But but as long as you can say why you did it, then no one can fault you for doing it. And that's a confidence booster that a lot of really new nurses do, because triage and ESI is not anything you're going to learn in school. It's not anything you've probably even heard of before you came into the emergency department. And so it's completely foreign to most people. So we're starting from, zero and trying to get them all the information they need. And sometimes an hour and a half long class is not enough. We find that with our new grads. Karen and I work with a lot of new grads, and we gave the ESI class in the very beginning, and then we talked about it, but we never really went back and reviewed and everything. And now we sprinkle that ESI examples throughout the entire class, because we know it's not something you can say, I'm going to give you a 2-hour class and then you're done. And I think this really gives you a lot more confidence, a lot more information to be able to support what you're documenting and what you're saying the patient is.
Yeah, great. Thank you for that. I know we've answered a couple questions that came through the chat. We do know that in triage, it takes a lot of collaboration during our shift with other people in the department, other healthcare professionals. How do you feel that the program prepared you to have that interprofessional collaboration and teamwork from some of the discussions and presentations?
I looked at that question from sort of 2 standpoints. I know it says other healthcare professionals, and the first thing we think of, is the provider, but also I'm thinking of other healthcare professionals such as nurses in the role, like in navigation, in charge, and all of those. So I know we've talked a lot about justification and talking about why I made this decision. Do I feel confident in making this decision? The other part that I would say is also trust. Trust that, you've been put in triage, and therefore the people that are also on your team trust you in that role. So if I go to charge, I'm a brand new nurse. It's still intimidating for me to say, hey, this person needs to go back right now, right? Having the practice now to be able to do that before I actually got to the point where I had to do that was very, very helpful. And hearing from other experienced nurses, and this is one of the big parts of the program that I like too, getting to talk to people who have been there, done that, and say, no, that is your job. You need to be able to do that, was really helpful to hear. Being able to hear that if you set it as a 2 and the doctor comes to you and says, hey, why did you set it at a 2? This sounds really simple, but being able to say, this is why, and that's okay, and you're telling the doctor something that they might need to hear as a brand new, I would even say baby nurse, if you're in triage, that's okay. I just needed to hear that. I did. I needed to hear that that was my job. I needed to hear that that was an expectation. And I needed to hear that, as Martha and Kara have been saying, as long as you can justify it, you're doing the right thing. And also, what she said really helps. Hey, if you're wrong, you're wrong. That's also a good thing to hear whenever you're new as well. I don't want to be wrong, but it's nice to know that it's not perfection that's expected. It's effort and an honest desire to do your best in this role.
Thanks, Nick. We've gotten a couple questions too on when does it make sense for a nurse to take ENTEP. We do have our position statement, and that does recommend a nurse having a year experience to be in triage. However, we do know that triage also happens at the bedside. Patients arrive in various ways. So that's going to be a decision for your department to make on who would take the course. Speaking of courses coming up, I have a very exciting announcement. We have our first set of courses scheduled. Registration will be open early June. These courses are delivered virtually. So the day and a half, July 30th and 31st, and August 20th and 21st. Keep checking back on our triage page. I will share a couple QR codes on our next slide. For these specific courses that are delivered by ENA, the cost is $375 for a non-member and $300 for a member. So again, keep checking back. We'll send out communication again when that registration is open as well. These QR codes here will take you to two different things. The first one here will get you to our triage page. And then if you have more questions, especially about group sales, purchasing it for your department, then that is the second QR code to a form. I will check the question box one more time. But if we didn't get to anything, there is, again, follow-up, sending out an FAQ. You can also get this recording if you have no other staff members who wanted to attend who weren't able to. We do appreciate everybody's time. We thank our panelists too. This has been very exciting here at ENA and getting to now share this out with you all. We hope everyone has a good rest of your day and more to come.